So the process of inflammation, as we say, can mean one of five things. Whether something is red or hot, whether something is swollen or painful, or we have just completely lost the function of that organ or body system. Some people will say, I've lost the function of being able to have a peaceful night's sleep. I've lost the function of being able to walk up and down stairs or even take a few steps without there being pain. So we can put that into the term of just saying that that is now an inflammation that my body now needs to repair. Now, sure, one by one, we can try to eliminate those triggers that have accumulated in our life. Perhaps for some of us, we can get pain at the end of a day or after a 3-mile hike or at the end of a tennis match. But most people don't want to put tennis aside to eliminate pain. Most people want to continue taking hikes with their children. But some of us have to start eliminating some of the burden that we put on our body. But for the rest of us, we are always in a constant state of trying to repair that inflammation, to decrease that swelling and decrease that pain in order to promote the healing that our bodies has the ability to do. I love my friends in the chiropractic world who say if we put the body in alignment, many things can start to fix themselves. So we kind of start saying the same thing when it comes to our own internal system, whether that's structural analysis or in this case, neurotransmitter or hormones. Neurotransmitter is a kind of a big and fancy word for saying a signaling. And most people recognize this more in the terms of more like hormones. So how does the body deal with sugar? I ask a lot of people. Well, most people are familiar that our body has to use a hormone called insulin in order to properly put sugar in its place. Well, how does your body deal with inflammation? Now, for years, that's been a question that has, passed a lot of us in the scientific world. And many people have just sort of had the natural ability to heal themselves. Athletes tend to have found the secret to life when they start talking about endorphins and runner's highs. And, I feel better once I start getting my body into motion. But we now start finding in the most recent years, we started finding that term endorphins is just another reflection of the term we call our endocannabinoid system. The system that is designed to keep our bodies in balance. So when my body gets some kind of irritation, there should be some feedback that tells your body to stop sending that signal further. Just like an air conditioning system in our house, if you set the temperature and the house or the room temperature now reaches that point, a signal should be generated back to that thermostat that says you can turn off. You no longer need to send the signal to continue to push this air conditioned unit or in our body this pain or swelling or whatever that tendency for our bodies to react to that stimulation is. But for many of us, we've lost that ability. We've either lost that ability or we never properly had that ability to begin with. And so we see a run of the stories of disease from small children all the way to adulthood. Now we understand why people in adulthood tend to have disease. Accumulation of stressors, accumulation of pain or walking or that has led to arthritis or accumulation of poor diets and choices throughout my life that has led me to having anxiety or diabetes or high blood pressure. But we also see these same diseases in small children as well, which tells us that just like our cases of other diseases, either we can overcome and have so much stimulation of pain and disease that we overcome the body's natural ability to manage that, such as our diabetics. Their diets are poor for most parts. They take in a higher than normal glycemic amount in their bodies, and their bodies naturally have an insulin amount to balance it out with. But we also know that we have children who also suffer from diabetes as well. And so in their case, they were never born with a proper, or maybe an insult came at an early age that no longer allows their body to produce the same amount of insulin that you and I tend to have as well. So in our bodies, we look at what does our endocannabinoid system look like. So our endocannabinoid system is very funny. In most cases, when I'm trying to send a signal in my body, I'm always talking about sending a signal downstream. So when the brain tells the toes or the feet to move, a series of relays of neurotransmitters are sent from one nerve to the next. Now remember, I told you that our endocannabinoid system is meant to give that feedback. So once the receiving nerve has filled its limit, then a system or a hormone or a neurotransmitter should be sent back upstream in order to say, now we can stop. And that's when we start talking about our endocannabinoids. So why do we start running out of this system, and many of us continue to have pain? Do any of you guys have concerns today about the need for chronic pain? I think, Delina, you said
CBD, so I'm good.
But at one point, Delina, I think you shared with me that you had some chronic pain.
Yeah, absolutely.
You had chronic pain. So in one aspect, a nerve or bundle of nerves was inflamed and would not heal itself.
Right.
But once you started introducing CBD into your system, the balance started to come into view. And now you're no longer able or no longer need to take outside pain medication. We see this same story time and time again. Anxiety patients. Patients who have to take multiple amounts of Xanax or benzodiazepines or other medications in order to calm down their overall stimulated system. So what we find with endocannabinoid system, when it's not there, we don't have that balance. Back in the day, we started finding that, and one of the best research studies that did come out was this show that what if we blocked our endocannabinoid system? This was a philosophy that came on trying to lose weight. It always comes out as something fancy, right? So we were thinking that people who use cannabis tend to have the munchies. They tend to want to go eat. So what happens if we can block those same receptors? Well, what we found was people were suffering from now having more depression, more anxiety, and more pain. No longer having the ability to cope or to deal with their day-to-day struggles. So although maybe blocking our endocannabinoid receptors is good if you want to lose weight, it's horrible if you want to stay in balance and have a peaceful night's sleep or just be able to recover from pain. Our endocannabinoid system, many people have heard of this in multiple different ways, is a nice a hormone or a chemical that can also be represented and reflected by an outside chemical that many of us have called CBD or THC. So in the world of endocannabinoids, we tend to think of the body's stressors needing to equal our body's endocannabinoid system. When that balance finds itself out of ratio, then your chronic pain to your healing ability starts to decrease. You now have more chronic pain than what you can balance. Now, we've used cannabis for thousands of years. It's been documented ever since 2000 BC using cannabis or hemp in order to take away headaches, to help with anxiety, and things of that nature. But it doesn't always work the same for each and every one of us. For one person, they can have a particular reaction to cannabis in a positive way, or even to our CBDs. And for others, it may not work at all. So why does that become the case? So we have to recognize where are we? Am I a person who needs to take CBD, Or am I a person that nowadays, now that we have open conversations up around medical marijuana, am I a person who actually needs to take THC as well? CBD, for the most part, is an augmenter of our own body's endocannabinoid system. So augmentation or to help. CBD helps our natural endocannabinoid system. So I tend to tell people, if we had 10 units of pain, then we need 10 units of endocannabinoids in order to balance that out. If our ratio is off, pain and anxiety can start to present itself. But if I can boost my own body's natural endocannabinoid, or rather, instead of boosting it, just prevent it from wearing itself away, then I can keep that endocannabinoid system around a little bit longer in order to find my balance a little more. So CBD is a great use for many people who are on the edge or in their early stages of disease and finding balance in their bodies. So for some people, and Delina, thank you for having us here, because you carry multiple different types of CBD, full spectrums, isolates, different brands. And for many of those, patients are trying the one that their body best responds to, absorbs, and then also can activate or supports their natural endocannabinoid system. However, we don't always get the same results for everyone, right? We can have many patients that come in who have the same exact diagnosis. A diagnosis, in my definition, is a series of events that has led to a series of inflammation that we now put a name on. So whether that series of inflammation now comes out, and I say I have chronic pain throughout my body, I may call that fibromyalgia. If I say I have a series of chronic inflammation that then leads me to not sleeping well, then I call that outcome insomnia or anxiety or cancer, so on and so forth. But at the heart of it, what we're really trying to do is trying to balance out this inflammation that we're having in our body. So what we see when we have multiple people come in with the same disease, and then why does one person not respond the same as their friend beside them? It may be that their body is not, they need a different delivery system. They may need a full spectrum versus an isolate in order for their bodies to best respond to it. However, there are some who, once they have surpassed the CBD category, their ratio is still more out of balance than what CBD's 5 to 10% boost can offer to them. THC, or what many people have known versus hemp, which is predominant CBD, is a direct agonist, or looks just like our body's natural endocannabinoid system. So where CBD helps to support and prevent the breakdown of our own body's natural endocannabinoid system, THC can be a direct representative or substitution or supplementation, that's the word I was looking for our body's endocannabinoid system. So we sometimes have found that many patients who have been resistant to CBD or have been resistant to multiple lines of therapy, including CBD, once we introduce THC, now they start to see the benefits of the full plants, right? They now start seeing the benefits and the return of quality of life back into it. Many of my clients have used cannabis in multiple different ways to get different types of reactions. We have clients that have applied cannabis or a balm to certain joints to get a localized reaction. We've even had some who have taken it either through inhaling it or even ingesting it in order to get a systematic approach to trying to regulate their inflammatory process. But this is just a way that we're trying to really refine that balance back into our inflammation to repair system. Now, obviously, in order to come across or to fix any disease, as I put my foot down on the brake, I should start to take my foot off the accelerator. So we always talk about our endocannabinoid system as a reflection of our lifestyle. Now, sure, it's a great idea for us to support and to boost our endocannabinoid system, but we also need to know that we have to work on proper lifestyle management as well to no longer trigger those same stimulations back in our body. Natural Remedy ND, we are highly prized on talking to our patients about the benefits of our endocannabinoid system and trying to help them find the best type of cannabis that works along with them. Anybody know the two main strains of cannabis that are out now?
Indica and sativa.
Yep. So, high five. I got some candy here. We could start giving treats. So we do have two main brands, two main strains or families of cannabis. Our sativas and our indicas that can have very different effects on a person's bodies. So what we will also need to recognize are the different types of disease processes or outcomes or signs of inflammation that people have in order to make sure that we match the right type of strain to the right type of person or set of inflammation. But even more than that, we even go into, as we've talked earlier about full spectrum, CBD. We also talk about a lot of the intertwines of the cannabis strains themselves, the terpenes, and how they also have a significant outcome as well. So these are just many of the things that we at Natural Remedy MD that we're here to sit down with our clients to really help them to understand what is their series of inflammatory events that has come across them and their outcome, and what is the best for them. Many clients that come in can probably find some additional benefits of just CBD alone. So CBD, although it may have a trace amount of THC in it, depending on how you use it, we can find CBD that has no THC. It's just a true isolate of that plant. All the way to clients who may need to have THC added in. So we have a full spectrum, a full outcome. So whether you are a first-time user, whether you have a job that does not allow THC, we have available products for everyone to meet their inflammatory needs as a medicine that can replace, and I always talk about cannabis and even CBD as a medicine. It is a medicine that we can use either along with other traditional medicines or in replace of. So if anybody's interested in asking having more questions, more detail, to try to find out what is the best type of cannabis for you, what's the best type of delivery of CBD for you, for your medical condition, we're here for you to be able to answer that. Any questions that you guys, I know that this crowd here has already educated themselves on CBD a lot, so I want to make sure I answer any questions that you have as well about CBD or the endocannabinoid system. Do you have any that come to mind?
I'm just getting into the different types of the doctor that I'm studying with. Just its knee jerk is you need this much CBD, this much THC, and this balance of terpenes, with whatever he's treating. How do you decide those kind of things?
That's a great question that I think at this point right now, we're still looking at a lot of research in order to kind of give a specific diagnosis, and treatment plan right away. Unfortunately, right now we are trying to do a little bit more, or my approach is to start most of my clients at a 50-50 blend of CBD to THC, unless their clinical history tells me more than that. I tend to think of chronic inflammation, such as fibromyalgia, such as some aspects of pain, anxiety, as being clients that can benefit from CBD. But that's not always the case. We've actually seen that certain types of strains of sativa that has a little bit more CBD predominance in it can actually make some anxiety worse. As far as those that have chronic pain, have difficulty with sleeping, things of that nature, those clients may need a little bit more THC and introduce into their system in order to kind of cause some of those aspects. And then as far as your terpene profile, you're exactly right. Having terpenes or having the right terpenes for that situation is so important. So some terpenes can be also stimulating. Some terpenes can cause blood pressure to drop. Some terpenes can cause sedation. So knowing this with our clients, to know, aside from your pain that you're here for today, do you also have blood pressure issues? Because we need to understand that as we start to introduce. But I will tell you that cannabis is not as consistent of a medication as many of our over-the-counter medications are. But the trade-off is that although cannabis may not be consistent, meaning that if I had 6 to 8 people in this room who all had the same medical diagnosis, and I introduced only one strain of cannabis, 2 or 3 may have a reaction or result, and 2 may not. Right, so it doesn't always work the same for everyone. There's a blueprint, I kind of call it a genetic blueprint match that has to happen between the plant and the person. With that being said, but kind of going back to your conversation, the best way that I like to kind of start my clients off with is a balanced blend of CBD to THC. And then at Natural Remedy MD, we offer free follow-ups for patients to come back in and to discuss it further. Doc, I started off, with the 50-50 blend or 1-to-1 ratio blend, but my pain is still high. Okay, well, let's increase your THC. I started off on this strain, but it's too sedating. Well, let's dial down the THC and move up your CBD. So, unlike many medications, where we are using some objective evidence of blood pressure readings or just knowing that I start all of my patients off on 25 milligrams of this medication. Cannabis, I try to be a little bit more conservative. I start them at a certain blend, but the most important aspect of my management with my clients is a good history. Is actually having them come back, let's actually talking about how has your quality of life improved? Are there any negative side effects since you have recently started on this new medications? What do we need to adjust as far as frequency, time of dosage, or actually the dosing itself within the medication? So that's kind of how I think when you came in, we were kind of talking about diet as well. What's the best diet out here in America? The best diet or the best form of cannabis is a cannabis or diet that works the best for your particular situation without causing any side effects that you can do for the most consistent basis. That's kind of my perspective of the best approach and the best medication of cannabis or CBD to THC.
I think one thing that we're seeing in holistics, as I always tell people, if you're on CBD, and I'm a prime example for my blood pressure. I've had high blood pressure since my teens, and it was always like 160 over 80, and now it's like 120. But now my physician is now taking me off my blood pressure medicine, which I've never been off of in 50 years. Totally hold on. But no, since my teenage years, I have been on blood pressure meds. And now, but one of the things I tell our customers, if you're on CBD, check with your physician, because they may, reduce the amount of medication you need. Now, since I've been studying CBD, from what I've been told, is that CBD can actually make your medication work better. And then your body's immune system is also working better. So you may not need the blood thinners. You may not need the blood pressure medication. You may not need all those meds. And so you just need to have a physician that's very aware of what you're doing to balance, like you said, balance that out. Now, the way I've got rid of my pain completely, just like what you said, CBD was good for me, and changing my diet was good for me. However, I needed that extra boost to get to that pain, to reduce that pain. So I boosted up my THC level. Granted, we don't have THC here yet in Missouri, hopefully. I did get my medical card. But it's just that finding that right balance, and that's where, like you're saying, isolates are good for a certain thing, but it's not a cure-all for everything. You have to see what you're treating, what medications you're on, and then your lifestyle and your budget.
Yep.
I mean, good quality CBD doesn't come cheap. So
It's a good investment.
yeah, it's a very good.
It's a great investment, because what she just described in my medical terms is that since her teenage years, she's had an underlying some level of inflammation underlying her complete medical lifestyle or her history. And maybe it was a conscious aspect that she did, or maybe it was just a sensitivity that she was unaware of. But the outcome of that was that her body was in crisis.
She also changed her diet.
Her body was in crisis for whatever reason. The body was in crisis, and the result of that came out as being, for some people, when they're in crisis, their bodies release a little bit more sugar. So if my body's under crisis for long periods of time, and when I constantly am releasing more and more sugar into my system, I can push myself towards becoming diabetic. My body's under a constant state of crisis, and my blood vessels and my heart rate are responding to that. We may call that, in the end, high blood pressure. So once she started making those lifestyle changes, started adjusting her diet and decreasing the inflammation that was exposed to her in her diet, making changes in her exposures around her environment, but also now introducing a buffering medication that in and of itself also works to decrease inflammation as well, without causing the negative side effects. Because to be honest, we do have other over-the-counter inflammation medications, NSAIDs, right, that we sell over-the-counter at every store, grocery store, things of that nature. My grandparents were part of the aspirin generation. You took an aspirin for everything to decrease your inflammation. But there are side effects to some of these medications, whether that's stomach upset, whether that's kidney damage, whether that's liver damage. We can track gout, right? We can track a lot of these secondary diseases to the primary medicines that we were taking for something else. Cannabis tends to not, our CBD, our exocannabinoids, tend to still serve the same purpose of being an adaptogen as far as managing our body's inflammation, without having such an acute impact on our body's other functions, such as liver disease and kidney disease. But it is a medicine. As any medicine that we put into our body, it has to be processed. And so cannabis is processed in our liver. So it's taken from an external chemical and then converted into a water chemical that our bodies can later excrete. But what that means is that it competes with other medications that also have to go through the liver to be detoxified as well. We in medicine field call that a drug-drug interaction. This drug interacts in a different way with this other drug. So, and sometimes when one drug interacts with another medication, it may boost the effects of that second medication. Simply because I can't, for one reason, maybe I increase the strength or I inhibit its breakdown because the liver is busy managing the CBD and it doesn't have the time to manage this other medication that you just took, right? Ladies are familiar with this. If you've ever taken a birth control pill and your doctor say, hey, I'm about to give you an antibiotic, be cautious of not getting pregnant for this next 2 weeks because your birth control medication may compete with this antibiotic that I'm going to give you, and we may also turn down that medication as well, or disactivate that medication. So we have to recognize that that any medicine that we introduce can have these effects, and that's why it's so important for patients to have good conversations either with doctors such as myself who are open to medicinal marijuana usage of medication, or and I also understand how that can interact with your other medicines, or talk with your own primary care doctor. Because like you said, many people, once they start using CBD and decreasing their inflammation, will tend to start seeing other medications that need to be adjusted down, or even sometimes up. Yeah, or off, completely off.
Their blood thinners especially.
Oh, yeah.
Because the INRs are gonna change.
Oh, yes. Yeah. INRs change, blood pressures change, anxiety medications change.
Well, there's statins, because they both go through the 3A4, and the CBD is a potent inhibitor.
Yes.
Of the 3A4, so you might see some leg cramping.
Yep.
We've heard of some of those things, especially with the oil carriers, because they're going through the first pass liver metabolism. So we've heard some of that with the pharmacist that does the.
And I'll just repeat that for the camera's sake, that medications such as blood thinners and statins are detoxified through the liver in the same way that cannabis and CBD are detoxified as well. So if you're using your CBD and cannabis, you may see some of the negative side effects of having too much statin on board, such as the leg pain, or too much blood, or your blood is too thin because the medication can't be, it hasn't been processed out, and it's still so active in the body because the liver is still busy taking care of this other medication.
That's kind of like what I was just like wondering about, like the medication thing.
Yeah.
Because I had read that, so I wasn't sure if that was like something that needed to be like discussed with like anybody buying CBD, like if it's a high amount that would start to like interfere with their medications.
Like the big warning is the
Like
blood
you-
thinners.
yeah.
Because of their INRs.
Yeah.
Good to know.
Yeah, I think the hugest warning is to always be aware.
Yeah.
You know, just be aware of your body. You know, and I mean, we don't do enough of that education nowadays. And for the most part, clients or people are constantly searching for vitamins and supplements that that help them feel better. And so many stores have, you know, they have shelves, you know, as wide as this building, that have every vitamin and every supplement that's on board. And even as harmless as that sounds, there can even be some cross reactions there. So, you know, again, I think that anybody that when they first start on cannabis, especially if they are sensitive due to age or other medical conditions, should be having proper follow-up with their primary care doctor or their endocannabinoid specialist in order to understand, you know, are you experiencing dizziness? You know, are you, you know, they're not, we tend to say we don't have a lot of side effect profiles that come along with cannabis, but we do have some unintentional or unwanted effects, such as too sedated, such as you know, blocking this other medication on board. So that's where you have to kind of have that conversation and kind of monitor that.
When you talk about the medical side of, you know, marijuana, when people come in, you know, this one I'm referring people to you, is that when they come in and CBD is okay, but they're still not achieving that goal, even if they change their diet and everything. And I think that's where the medical side can come in, because there's a balance. And I think, you know, clients, customers, they need to understand that don't be turned away if CBD isn't working for you, because like you said, it could be the amount of, they have to adjust the THC level in their system and their strength, because I know on the different, like I was on 3 or 4 different types of anxiety meds, and now I'm totally off because I'm using the indica, the THC, but to help me get over that. And you have to balance that right strain and the right strength, because you're right, it can be too sedating, you don't want that. But from what I've also read, that if you're getting to that high effect, CBD can also reduce that effect as well. Is that true?
That's very true.
Okay.
So I'll address the last issue first, and that THC will very easily cross the blood-brain barrier and start affecting some of our endocannabinoid receptors in our brain, and can cause some of the sedation and some of the other mental concerns that kind of go along with cannabis. So we have seen that cannabis over the years has increased in its potency of THC. Decades ago, when my mother or grandmother probably used cannabis at young ages, it was probably about 7% THC. Now we have cannabis that can be as high as 40% THC. And so when now when you go to the stores to purchase, and you're 65 years old, and this is the first time that you've used cannabis in the last 40 or 50 years, and you can have a very negative outcome. Anxiety can raise, and we're getting some admissions to the hospital based off of that. So CBD can easily balance those mental aspects down. So it's almost the treatment of choice to negative outcomes of cannabis. Just like if you have peanut allergies or insect allergies, the treatment of choice would be an EpiPen in that case. CBD, going back a little bit more, is unfortunately we are in a medical asset right now where insurance is not really helping to pay for our costs, which becomes a concern for some of our patients. And so many of our patients come in to use CBD, but CBD, they may find that they're having to use more and more and more in order to get that effect, or they continue to go from 500 milligrams to 1,000 milligrams to doing 1,000 milligrams twice a day, or even more than that. And what we find, and to some degree, is that there's a little bit of a ceiling effect when it comes to CBD. If it's going to work, it's going to kind of help fill that gap in. How much can it boost your own body's natural endocannabinoid system? Remember, CBD is an assistant of the endocannabinoid system. It is not a replacement of the endocannabinoid system. So if your endocannabinoid system is 10 or 20% less than what your body can keep up with, perhaps CBD can help bridge that gap for you, can help augment and boost the natural effects of your CBD by helping to keep it around a little bit longer. But if we need to augment higher than that, then we have to introduce an external supplementation of our endocannabinoid system, which we call THC. So with that being said, many times what we can also find is cost savings when we actually start to blend CBD and THC as well. Because CBD works, THC works, but when combined together, there's a little synergy that happens there. And so thereby, when you kind of use them both at the same time, you oftentimes see dosage and frequency drop just because of that perfect combination together.
You talk a little bit more about dosing, because there are some people you see always on the market, 1,000 milligrams, 2,000 milligrams, and from what I've researched, more CBD is not always the best.
Less is more.
Right, and that's what I tell them. It's not, you don't need
drops.
Right.
Yeah.
And that's what we, like if we have 1,000 milligrams, we only need a couple of drops.
Yes.
And you don't need a whole dropper full or a milliliter full. It's, you know, you're wasting good money if you do that. Is that the correct, I mean, how would you tell one of your patients to dose CBD?
Well, I think we have to think of it in one of two aspects. The first thing that I always say in medicine is that whenever we put a person on a medication, we're trying to find the least dosage that causes the best effect. So no one wants to come out and throw kill a fly with a bazooka, right? Because now you can have other side effects. So I think it's important to start low and slowly and strategically titrate your way up, okay? Knowing that there may eventually be an end point of that CBD usage as well that I had just mentioned. The second effect I think that we find in our body is what we kind of call the bell curve, okay? The bell curve effect. Yep. So when the body, we have to remember that the reason that CBD and THC is working is because our bodies was already naturally built to receive this chemical. So how did we get it in the past? Perhaps because cannabis or was a weed, perhaps our cattle fed off of it. And then we secondarily ingested the CBD or those endocannabinoids through our foods. Or perhaps we ate it ourselves. I'm sure cavemen enjoy salads. And so where did you get salads from? Perhaps it was this nice flower or plant that you saw kind of growing down the street from your cave or something to that effect. So perhaps we have also directly eaten or ingested cannabis as well. We have done a great campaign over these years of completely getting rid of cannabis throughout the United States. So we no longer have cattle that is eating off of the land. They're now eating food that we have processed and put in front of them. We also eat foods which are grown in controlled environments as well. So our supply of endocannabinoids or other vitamins is limited in what we have. So when we first start to introduce back into our bodies a natural chemical that our body needs, it loves it. It wakes up, it absorbs it like never before. And you may find in the very beginning of using the medication, you have a great effect that comes right away. However, once receptors continue to get dosed and bombarded, and especially if we overdose, then our bodies can give a little bit of resistance. It can start saying, hey, I was fine at 5 units. All right, I was fine at 5 units once a day. Now you're giving me 5 units twice a day, or 3 times a day, or 4 times a day. And the body has a natural ability to make more receptors in order for you to start filling in more, but there is also a ceiling effect of how many more receptors that you can take. So, or how many more receptors you can make, not take, excuse me. So what we then find in that scenario is that oftentimes people now start to get to the point where this is not enough. And now I'm trying to dose higher and higher in order to try to overcome the resistance that my body's kind of putting out. And we see that same scenario in diabetes, right? In the beginning, we have patients that come in, they're diagnosed with diabetes, we start them off on a dose, it works great for them, but because they don't make the significant lifestyle changes, their bodies continue to get burdened with the sugar, and now they have to take more and more and more medications to cause the same effect. So these are some of the aspects. So always start low, titrate yourself up slowly. Be aware that you may need to continue to titrate, or you may need to switch to a different brand or different spectrum of CBD products. And then once you have reached the ceiling of that, then maybe it's now time to now start to introduce THC in order to kind of help to open the receptors up a little bit more and augment this process all the way through.